Captain. Sure, please come in, take a seat, make yourself comfortable. Welcome to the medical tech. Glad to see you here. You do not visit us too often. Yes, I suppose that's a good thing. Sure. So, today is your standard general monthly medical examination. Yes, we check your health condition to make sure that everything is fine. Yes, just as usual, we start with some questions if you do not mind. Alright, they are quite standard. Firstly, I'd like to know about your sleep. How well do you sleep? How well did you sleep today? And anything so on? Yeah. Okay. So how was your sleep today? How many hours? Did you wake up during your night sleep? Couple of times. So, did you check your stress level this morning? Okay. So, I highly recommend you to check your stress level, well, at least twice a week. When was the last time you checked? Okay. So in that case, we gotta perform a quick mental examination before the general physical examination. Yes, so I gotta show you a couple of pictures. Yeah. So, can you look at the hologram? Take a look at this spot, at this picture, and please tell me what actually can you see here? Just your first impression. What are you feeling? Does this picture concern you, or you feel relaxation? Well, just describe it with your own words. What are you feeling? What do you think about it? Okay. The next one. Take a look at the picture and just describe your emotions, your feelings. What actually do you see here? Okay. What about this one? Okay. So does it concern you? No? Okay. And what can you tell me about this picture? So what actually do you see here? Okay, so any emotions, any concerns, or anything? Okay, and the last one for today. Yes, just describe it. Take your time. I know you are very busy, but we got to be okay. And any emotions, any feelings? Okay. So I guess your mental condition is quite okay. Yes, but again, I highly recommend you to check your mental condition and stress level twice a week. Yes, deep space is a very dangerous thing. So we are under the pressure every day, every week, every month, every cycles. So yeah, you know what I'm talking about. And the next thing, we just scan you. I'll just scan you to take your vitals, like blood pressure and pulse, and then I'd like to listen to your heart and lungs. Yes, please hold still for me. It's not hurt, just don't move your head. Yeah, we've done it many times. Yes, just look at me. Okay. You might hear some sounds. That is completely fine. Just look at me and... Alright, let me have a look. Okay. Everything looks good to me, so a couple of seconds. Alright. So as I've said, now it's time to check your lungs and heart. May I ask you to lift up your top? Yeah, that's enough, that's fine. And need to warm this thing up just a little bit for you. Alright, so now please just breathe normally. Yes. Like so, breathe in and out. Breathe in and out. Yes. Keep breathing normally. Keep breathing normally. Breathe in. Breathe out. Breathe in. Breathe out. Okay. Now, please make a nice and deep breath in and let it out. Exhale. Inhale deeply, and hold your breath. Hold your breath. Hold your breath. Okay. And exhale. For this side, inhale deeply. Hold your breath. Hold it. And now let it out. One more time. A nice deep breath in. And hold it. And now let it out. And now from your back, just breathe normally. Breathe in. Breathe out. Breathe in. Breathe out. And this side. Now inhale deeply. A nice deep breath in. Hold your breath. Hold it. And now slowly let it out. Exhale. Yes. So everything seems to be fine with your lungs and heart. The lungs are clean, absolutely no noises. So heart beats perfectly. Yes. This way. And we move on to the next part. So now I'm gonna be touching your face, neck, shoulders, if you do not mind. Do you actually? You don't think very much. So I'd like to, let's say, palpate your facial muscles. Usually it is ticklish, but if you feel pain or you do not feel anything, you tell me. Okay. So, yes. How well are you feeling my fingers on your face? No numbness. Okay, good. Next we check your ears. So now your neck. I'm gonna be palpating your lymph nodes on your neck, under your chin, under your jawline here. So does it hurt? No, that's good. What about here? No. So perfect. Now we check your lymph nodes on your chest. Again, does it hurt? No. That is good. That is good. I ask you to lift up your hands. Raise them. Yes, and we check your lymph nodes under the armpits. Okay. So, okay, put them down. Alright. Now I'd like to touch your shoulders. You seem just a little bit, let's see, uptight. Yeah. I definitely feel tightness here, like stiff muscles. Yeah. Relax your shoulders, relax. They are relaxed. Okay. I suppose that's a sign. Potentially it might be a sign of stress, or it's just artificial gravity on our ship. So, well, we all experience these kind of problems with the artificial gravity. I highly recommend you to visit a massage pod today before you are asleep, or maybe even sensory deprivation pod would be nicer. Yes, which one do you prefer? I'll massage your shoulders just a little bit. Massage would be nice. It'll help you to relax your tension, relax the tightness. Yes. Well, you seem uptight. If we talk about your shoulders, do not see any other signs of stress. Yes, but I definitely feel tightness and stiffness here. So massage would be very, very helpful with that. And if you need to relax your mind, so I highly recommend you to visit a sensory deprivation pod. Yeah, so if you want, I can add you in a waiting list. Well, that's a big queue to the you have your own one. Oh, sorry, I forgot. My apologies. Now, we move on to your ears and hearing. Yes, as well, I like to palpate, in other words, touch them. Yeah, so here is the same thing as with your face. I want you to tell me if you feel any pain or if you do not feel anything. Okay, perfect. So now, what are you feeling? Okay. Overall, have you noticed any problems with your sense of touch? Well, we faced a couple of cases in our crew. A couple of members have been experiencing, let's say, decreased sense of touch. Yes, in a couple of weeks, I suppose. Yes, I actually do not remember exactly how long they have been experiencing this problem, but we definitely have this on the ship, so we gotta watch on this thing because it might cause a problem. Yeah, That's because of the artificial gravity, as I've said. So we need to exercise and we need to massage our muscles. Yes, so use any opportunity to visit the massage pod. Every time you have the opportunity, just visit. Okay, so everything is fine with your muscles. I'd like to check them closely with the light. Yes, I'm gonna be doing the same. I'm gonna be palpating and touching. Now, we want to check if there are any problems with your skin or if there are any sign of inflammations. So I'm looking for any signs of potential inflammations like redness, dry skin, dry blood, anything like so. How is your hearing? I haven't asked before, so you hear me well, perfect. Now this ear. So again, I'm looking for any sign of inflammations and cannot see any of them. That's a good thing. No dry blood, no redness, no dryness, no skin flakes. Everything looks good to me. So now we check your ears inside. For this, I'm gonna need the otoscope. I'm going to put this little chip inside of your ear canal and going to be looking. Yes, it is ticklish. But again, if you feel anything unusual, any sign of pain, you just tell me immediately, okay? So I'm going to pull your auricle back just a little bit for more convenience to me, okay? So, are we good? We good, so, okay. Okay. Do not see any redness, that's a good sign. No earwax build up, no blockage. That's good as well. Okay. Now I gotta take a look a little bit deeper, so please hold still, very, very still. Yes, yeah, that's it. And now we move to your, hold still for me, to your right ear, okay? So, how you feeling? Okay. No sign of pain. No sign of nausea. That's good, that's good. Please do not move your head. And, no sign of redness. No sign of inflammations. That is good, that is good. So, now going to look a little bit deeper. Please do not move. Okay, that's fine. That was not your ear, that was my otoscope. Yeah, just click it to rotate for a more convenient angle. That's it. And now the final look. That is it. Everything is fine with your ears. They're absolutely clean, no earwax build up, so we don't need to clean them today. Now all we need to do in order to check your hearing will perform a standard whispering test, if you do not mind. That's your favorite one, glad to hear that. So you do know what we're going to do. Yes, so I'll be whispering and you'll be listening to the whisper. Yeah, there will be 3 numbers for each side. If you heard them, remember the numbers. Yeah, and when I stop, repeat them back for me. Okay, we start here. Okay. How well can you hear me? Perfect. So here are the numbers. 5, 7, 9. 5, 7, 9. Good. How well can you hear me here? Perfect. So here are the numbers. 10, 12, 14. 10, 12, 14. So, how well can you hear me now? That's good. So, the numbers are 15, 16, 13. Good job. How well can you hear me whispering here? I'm very quiet. Oh, good. Here are the numbers. 21, 25, 38, and 30. Perfect. I'll try to be quiet here for this side. Here are the numbers. 20, 30, 60. 20, 30, 60. Good job. So, the numbers are 45, 55, and 67. And 67, that's a nice result for the last time for this side. How well can you hear me? Good, so here are the numbers. 71, 18, 88, and 88. Alright. Okay, so how well can you hear me? Yeah. Okay, for the last time. 91, 71, 17. And the last one was 17. That's a very nice result. So we move on to your eyes. Alright, so now I'm going to be shining the bright light. Is it bright for you? Okay, so going to shine the lights in your eyes in order to check your pupils dilation. Okay, good. Do not look at the light, please look at me. It's not that bright as you said, but you might hear some blinded spots at these examinations, so I highly recommend you to look at my face, not at the light. Okay, so look at me. It's hard to look at me when the light is flashing in front of your face, but try to not look at the bright thing in front of you, so look at me. Just slowly bring the light into your field of vision. Just see, now I gotta cover up your left eye. Okay. So, blink if you need. Now, your right eye. Is that right or left? I've always confused left and right. This is your left. Okay. My bad, sorry. Okay. Keep looking at me tonight. look at me real quick. So I need to pull your eyelids down. That's it. And now look down for me. Good job. Look at me and blink if you need. Now look to your, this is my left, to your right. Okay. So, good. And now look to your left. Yeah. Okay, which is my right. So look at me and blink if you need to. Alright. Can you follow the light with your eyes only? Please keep your head very still. Do not move it. And just follow the light with your eyes. Like to check the eye movement. Yes, just look at the lights. Follow the light with your eyes only. Alright. Okay. So. Okay, we move just a little bit closer. The light movement is gonna be very, very, very slow. And just follow the light wherever it moves. And here, and to this side, to the center, down, and up, and here, and to your right, and to your left, back in the center, diagonally, to this side, to this side, back to the center, diagonally here, and diagonally down to this corner. Okay. And here, and up, and to your right, and to your left, and back to the center. Everything seems to be very, very fine. And okay, now we perform a quick test to check your peripheral vision. Keep your head very still. Focus on the tip of my nose. Gonna be moving my hands, my fingers like so. I want you to make your finger this way. And if you see the movement, just point in the direction. Yes. Focus here on my nose. Do not move your head. Yes, just keep your finger that way and keep pointing if you see. Okay, so now we're going to do almost the same. You just focus on the tip of my nose. I'm gonna be slowly moving my fingers out of your field of vision, and I want you to tell me if you cannot see them at all. Okay. Focus on my nose. So, can you see my fingers? Okay, do not look at them. Look at my nose. And just tell me when they are gone. They are gone. Perfect. Once again, look at my nose. Do not look at the fingers. And they are gone. Perfect, perfect. I suppose that's it for today's examination. Yes, we need to perform a very detailed medical examination in a month. Yeah, it'll be very long and detailed. According to the name of the examination, we'll be checking your cranial nerves, eyes, hearing, sense of touch, sense of taste, sense of smell, your reflexes. We'll check if it's necessary. We'll check your mental condition as well, again, if it's necessary. It'll be very, very long examination, so, but now, that's it. Thank you very much for your time. Thank you, and I suppose that's it. See you on the bridge. Okay, goodbye, Captain. Take care.